Hey everybody, since we're talking about gender dysphoria this week, I also wanted to kind of give you a brief overview of gender and sexual diversity and what that means and how it can impact our clinical practice. So, gender and sexual diversity is an umbrella term that encompasses all individuals whose sexual orientation or identity and or gender identity are not heterosexual and not cisgender. So, gender and sexual minorities is another term that's used. They're somewhat interchangeable. The difference is gender and sexual diversity is a little bit more inclusive and all encompassing, and it's more strengths based. So, I prefer the term gender and sexual diversity, although in some contexts, gender and sexual minorities works. But just be aware of how you're speaking about groups of people and the language that you're using. So, the gender unicorn is one of my favorite things, and it gives us a really good tool to understand gender and sexual diversity and all the different components that are involved with that. So, the top bubble up here next to the unicorn is gender identity, and that's how we identify our own gender, typically using terms like boy, man, or girl, woman, and those may or may not align with the sex that we were assigned at birth. So examples of kind of a gender identity would be cisgender, transgender, non-binary, agender, um, sometimes two-spirited. So gender expression, on the other hand, is the behavioral, aesthetic, and psychological characteristics by which an individual communicates their gender identity. And that can be things like how we dress, how we talk about ourselves, how we look, the pronouns we use, and all the things like that. So, this kind of presentation of it challenges the assumed naturalness of the binary model of gender, and kind of negates any correct gender expression or gender identity. Gender roles are socially constructed and historically and culturally grounded behavioral expectations of men and women, or people who identify as men and women. So, masculinity, femininity, androgyny, gender nonconforming are some different types of gender expression. And then sexual orientation includes physical, emotional, and romantic attraction and behavior, and it's a person's predominant sexual and emotional attractions toward others, and that includes things like gay, straight, queer, bi, asexual, pansexual, and those types of things. So, biologically, sex characteristics exist on a spectrum. They go far beyond what we once conceptualized gender as, starting off with XX chromosomes and then one of those little tails got dropped, so then it's XY and that's a male. No, that's not how things work. Since kind of the 90s, we've discovered that sex characteristics, including the genetics and the chromosomes and all of that, are so varied that we have really no idea, and that the binary mode that we think about sex is just completely off base. So we know now, after 30, 40 years of hard scientific research, that sex characteristics go far beyond just what we have typically learned as male and female. There are chromosomal differences, hormonal differences, genetic differences, all kinds of things that can impact a person's physiological and psychological experience of sex. So, kind of more recently, within the past like 30 years of sex research and education and understanding, researchers have kind of made a more inclusive category called differences of sex development, and those include things like disorders of sex development and intersex conditions, in which the kind of typically understood as traditional expression of gender is not completely within the male or female box. And so it's postulated that as many as 1 in 100 people have some form of sexual differences in development. And so I think it's really kind of important to understand, when you're talking about sex and gender and all these things, that you're not only potentially excluding and harming people who are identify as trans or non-binary or gender non-conforming, but you're also potentially harming and excluding people who don't meet the kind of the standards of what a man or a woman should be. And so if you're saying that, well, this is the cutoff for a male, or this is the cutoff for a female, what happens to those people who just naturally fall in between? And so I think it's really important to think of sex and gender as this whole big picture system thing that's going on. It's not just limited to one or two aspects of our physical expression or our worldviews. It's everything. And so, I talked about this. I'm skipping over a few things, sorry. So, just some things that you should know. People who are gender and sexually diverse are a lot more likely to experience depression and anxiety. They're more likely to be victims of interpersonal or domestic violence. They're at higher risk for developing eating disorders, substance use disorders, and other kind of risky or dangerous behaviors. They're a lot more likely to experience negative social outcomes like family rejection, social isolation, and things like that. And a lot more likely to experience suicidal ideation and suicidal attempts. So that's some reasons why you should care that these things are going on, and just some reasons that, or some things that you should be aware of as you are practicing with these groups of people. And then within the gender and sexually diverse umbrella, there are a lot of within group differences. And so you should be aware that bisexual individuals are very commonly experiencing the lowest emotional and social well-being, and that there are higher levels of suicidality and non-suicidal self-injury, as well as kind of unique experiences with discrimination and stigma, where they're ostracized from not only kind of the heterosexual world, but also the LGBTQIA plus world, because, you know, bisexuals don't exist, or it's just a phase. So there's a lot of biphobia and a lot of bi-erasure that contribute to these kind of lower well-being outcomes for bi individuals. Also, please note that transgender individuals also experience much, much, much higher rates of anxiety, depression, and PTSD than sexual minorities. They also have a much higher rate of suicide attempt and death, and are the most victimized and discriminated against group of people in the country and possibly in the world. So just some kind of basics and fundamentals of working with people with gender and sexually diverse identities. Don't be afraid to address sensitive topics, just because you don't understand or whatever. Don't be afraid to go there with them. They're still humans. A huge one is just be mindful of your own biases. I know it's difficult to address those, but we all have biases, and so it's just really important to be aware of those as we are working with people that we're not familiar or comfortable working with necessarily. And then be aware of their clients' mistrust of health services. They've been very often treated negatively or refuse treatment within the healthcare world. Ask questions and normalize disclosures. Like, thank you for telling me that. I really appreciate you being open with me. I know it's difficult to do, especially without that shared identity. Express and maintain confidentiality. This is really important because a lot of people are being afraid of being outed, and that really needs to be within their control. And then finally, be familiar with referrals and resources that are specific to the population that you're working with. Always, always, always educate yourself. It is never, ever the responsibility of the marginalized population to educate you or to make you feel comfortable. One of the most common grievances from GSD individuals within healthcare communities is the lack of their provider's knowledge or their provider expecting them to educate them. Like, no, you're the healthcare professional. You need to be knowledgeable about this stuff. You don't expect your clients to come in with knowledge of other diagnoses or other issues. You learn that on your own. So part of being culturally aware and culturally sensitive is obtaining that information for yourself and not expecting them to educate you. Use inclusive language. Use gender neutral or non-gendered language, including pronouns. So instead of saying, like, do you have a boyfriend or do you have a girlfriend? Are you seeing anyone? Are you romantically involved? Open the pronoun conversation without having to be explicit about it. Hey, my name's Sarah, and my pronouns are she, her. Hi, how would you like to be identified? Or how do you want me to address you? In terms of clinical focus, if you're working with trans or queer or otherwise gender and sexually diverse individuals, don't emphasize that aspect. Don't focus on that if that's not kind of what they're coming to you for. You'll want to provide information and education on gender identity, sexual orientation, and various options for treatment. You want to work on enhancing social support and peer support and providing support for family and making appropriate referrals whenever necessary and whenever possible. If you are going to be focusing specifically on gender aspects during therapy, there are some potential areas that you could address only if your client wants to, and those include kind of assessing gender dysphoria and exploring those concerns and finding ways to alleviate that dysphoria here and now, clarifying and exploring gender expression and roles, exploring identity and expression, and addressing kind of negative impacts of stigma and oppression, including alleviating some of that internalized homophobia or transphobia. You might want to help them facilitate the coming out process and navigate those family dimensions. You'll want to promote interpersonal skills and resilience because they're going to be in a world that's just not very well equipped to handle transgender, nonconforming, and sexually diverse people at the moment. So the overarching goal is to help achieve long-term comfort in their gender identity and expression with a realistic chance for success in relationships, work, and education. That's it. Just the same goals for everybody. We just want everybody to be good. So, focus on what is distressing to them and don't harp on gender and sex if that's not what they're concerned about. Always keep in mind, if you don't know, ask. The client is the expert on their individual experience, and that's always true regardless. Don't make assumptions just because, I've got a trans friend or a gay cousin that you know what the person's going through. Mistakes happen, if they do happen, if you misgender someone or make an assumption that someone is in a heterosexual relationship, just acknowledge that mistake and, work to improve the behavior. And listen and be compassionate. That's kind of one of the main things that we do in our profession anyway. And you just want to provide a safe space for people to be themselves.